Hi, hello everyone. My name is Dr. Rajendra. I'm an interventional cardiologist in Narayana Hridayalaya, Mysore, and I keep getting these queries about from patients about various different concerns they have about their heart. So we thought that we'll just put it out in the public domain for whoever is interested, and further questions like this are more than welcome, and I hope it is of use to a few people at least. So firstly, people ask me, what is a normal heart? So to them I say, a normal heart is a muscular pump that works very hard throughout our lives. A normal heart has four major components, and these are the muscle, which acts as a pump, the blood supply to the muscle, which supplies blood to the muscle to keep it going, the electrical system of the heart, and also the valves that keep blood going in one uniform direction. So a normal heart is about the size of a person's fist, and it beats 60 to 70 beats per minute. So if you say, for example, a normal person's heart beats 80 times in a minute, so it pumps around 5,000 times in an hour, over a lakh times in one day. And if a person were to live for 70 years, it would have pumped 3 billion times. So you can see how hardworking this heart is. So let us go through a few questions that my patients have sent me, and let us try and work through those. So the commonest question that I get asked as an interventional cardiologist is, what is a heart attack? Okay, so a heart attack, or myocardial infarction, as we say in clinical terms, is an event that is caused due to obstruction to the blood supply to the heart muscle. So the blood vessel that supplies blood to the heart, which is the coronary artery, gets blocked. Usually this is because of a rupture in what we call as a plaque, which is inside the blood vessel. This causes aggregation or accumulation of the platelets, and this causes obstruction to the blood flow to the heart muscle. So this is characterized clinically by commonly chest pain, which can be very severe. This is associated with sweating, nausea or a sensation of vomiting, or indeed vomiting, breathlessness, and also the pain can get referred to the shoulders, arms, or the back. It is associated with a feeling of apprehension, of fear, and the pain can be very intense and severe. So the pain is quite severe, and heart attacks, as we know, can be lethal. Patients have suffered cardiac arrests because of heart attacks, and it is very important to recognize the symptoms and seek medical help as soon as possible. The next question that I get asked is, are all chest pains due to heart attack? The answer to this is certainly not. There are various structures in this part of the body that can give rise to similar symptoms. So if you can imagine, the body is made up of skin, adipose tissue, there is muscles, bones, and inside the chest cavity there are lungs, then there is the heart, behind that comes the esophagus, which is the foot pipe, and behind that is our spine. So all of these structures, the pain sensation is carried by the same sort of set of nerves that take the pain sensation. So any structure that has abnormality can give rise to chest pain, which is usually, in my clinical practice, up to 50 to 60% of chest pains are what we call non-cardiac chest pains. That means that the pain is not because of heart attack, but could be due to anything else. The commonest ones are musculoskeletal chest pains. Then there is esophageal spasm, or indeed there is pain due to the gastritis or esophageal reflux. The most important thing to find out whether this is from the heart or not is to seek medical help and undergo certain tests. The commonest tests are ECG, echo, and based on these we can have further tests. The main importance is to rule out a life-threatening cause, and the life-threatening cause, apart from a heart attack, are what we call as pulmonary embolism, which is blood clot within the lungs. Then there is aortic dissection, which is a tear in the main blood vessel that comes out of the heart, and also rupture of the esophagus, which is a food pipe. So any chest pains, certainly if it is severe enough or if it keeps on recurring, has to be evaluated and needs to get medical attention for this. I also get often asked as to whether heart attack is the only problem that can occur in the heart. Again, certainly not. If we go back to our 4 components of the heart, any of the components getting deranged or being abnormal can give rise to problems. So heart attack is because of the blood clot or obstruction to the blood vessel supplying blood to the heart. There are other components of the heart like the muscle, and the problems with the muscle could be that the muscles can get weak and can give rise to a weakness of the heart. And there is also other conditions wherein the heart muscle is very thick. This could have its own problems. Apart from the muscles and the blood supply, there is electricity, which can give rise to problems in the form of either fast heart rates or slow heart rates. And then there is, of course, the valves. The valves can also be problematic in the sense that they can be leaking or they can be obstructed. Both of these give rise to problems. Again, the valves could well be infective or rheumatic. We see a lot of rheumatic heart disease in India. And also there is the degeneration of the valves that can give rise to the problems of either leakage or blockage or obstruction to the flow across the valves. Most of these problems can have a common set of symptoms: fatigue, breathlessness, either on exertion progressing on to at rest later, swelling of the legs, extreme exhaustion along with fatigue, palpitations, that is a sensation of the heart beating very, very fast, and chest pains. Patients often ask me, and even for that matter, families ask me whether they can lead a normal life after suffering from a heart problem. So it is very important to define as to what exactly is normal life, because a lot of people have led lives that they think are normal, but clearly has not been very healthy. On a serious note, however, after suffering any heart problem and having sorted it, it is very important, I think, that patients and their families get every support to help them to get back to their normalcy. So there are trained professionals who can help patients do this, and it also depends on what exactly the problem has been that the patient had suffered from for them to lead a normal healthy lifestyle afterwards. In the West, there is established cardiac rehabilitation programs that clearly have set guidelines and a proper protocol to follow to try and get the patients back to normalcy. These cardiac rehabilitation programs have dedicated professionals who have nursing, physical training and psychologists along with doctors' inputs, and it has been shown in controlled trials that cardiac rehabilitation is as important, if not more, compared to medicines in terms of helping patients get back to their normalcy. It's very important for a person to get along with their peers or people who have been in the same sort of situation, get to know and try and talk about their problems, because what we do in many situations is treat a patient, send them home, and they have no idea as to when to start exercising or when to go back to work, what they can do, and this creates a lot of apprehension. So I think a cardiac rehabilitation program is very important in trying to get back to normalcy, and certainly patients should seek their doctor's help and advice and guidance in trying to get back to as normal as they can. It may not be possible in every situation, but certainly in a majority of the situations, people can get back to normalcy, especially after we do a lot of stenting procedures, angioplasties, primary angioplasties, for example, in acute heart attacks when patients come. We are seeing a trend of more and more younger patients coming and getting treated with primary angioplasty for heart attacks. And in this subset, as in any other subset, it's very important to try and get them back to normalcy. A lot of people ask me health tips regarding healthy lifestyle, and if I were to think, I think I could give at least 8 or 10, but we will limit ourselves to what are the most important ones and maybe try and elaborate at a later time or date. So firstly, smoking. We have a huge pandemic of coronary artery disease, diabetes that is engulfing our population, and smoking clearly puts an extra risk into everybody's profile. So avoiding smoking or quitting smoking is certainly my top priority. Secondly, I think we should all learn to stay active and healthy. Active means staying active implies moderate intensity exercise for at least 2.5 hours per week. So if you break it down into weekdays and weekends, if a person engages in brisk walking for at least 30 minutes, then they would have done their part. But it's not just this, it is also, especially with the current generation of professionals that spend a lot of their time behind the desk or behind a computer, I think it's important to try and keep active throughout the day. Taking calls when you're walking, or just climbing stairs rather than taking lifts. All of these help, even though in a small amount, it goes on to give you the advantage of having burned the calories and not just accumulating them. In parlance with this, I think we also should have a very balanced diet. Balanced diet implies that we cut down on our saturated fats, we cut down on salts, we take 5 portions of fruit and vegetables a day, and also we have a balanced amount of nutritious food. We certainly have to read the label nowadays to see what exactly is in the food that we're eating. All of these help us to maintain and achieve firstly and maintain active weight, that we won't get obese or overweight. And on top of all of these, I think we should learn the fine art of chilling out. Type A personality, or we should all learn the fine art of chilling out. I think the more stressed we get, the more type A personality we are, we know that we are putting ourselves at risks to having a coronary event. One of the other important health tips that I would offer is that in this age of fast-moving traffic and life, we tend to get carried away and not spend enough time on ourselves. So I think it's very important to have regular health checks. There's no arbitrary age for one to get their own health checked. But clearly, if one is turning 40, I would say this is the time to get a set of tests done to ensure that along with your family history and your lifestyle, what other risk factors you have. For example, if you have blood hypertension, which is high blood pressure, certainly along with lifestyle modifications, if medications are advised, one has to be compliant with medications and get regular health checks. If somebody is diagnosed with diabetes, again, it is very important to be compliant with medications and have regular checks so that we can keep a check on the disease process itself and ensure that we do not have an excess risk of having a heart attack or in fact any other cardiovascular event. So it's very important to have health checks along with healthy diet, lifestyle, being active, avoiding smoking, and as I mentioned, it is where with all these we can ensure that we keep a healthy heart and not let it fall apart. So I think life is stressful for everybody. Dealing with that in a less responsive way is probably a very good hint that I personally have adopted myself. So I think de-stressing ourselves with exercise and also all the other parameters that I've just mentioned would certainly go a long way in keeping our heart healthy. So my final tip is to take care of your heart and don't let it fall apart. Thank you.